Hello, I'm Dr. Deborah Wilson. Welcome to our webinar. We are going to be discussing two treatments, Morpheus V and V-Tone, and I'll tell you more about them in a little while. So to give you some background, as women age, particularly if they've had vaginal births of a large baby or multiple vaginal births, women tend to get some vaginal laxity as a result of that. The vagina is stretched and it never fully recovers from that birth experience. Oftentimes, actually, the wall between the bladder and the vagina and the wall between the rectum and the vagina become very weak. And patients will tend to feel kind of open in that area, not like they felt when they were 20 years old, but kind of open. And intercourse tends to be a little less satisfying just because they are loose. Also, as women age, the muscles in the base of the pelvis become weak. It's kind of hard to exercise those muscles purposely, and those muscles, that whole pelvic muscle hammock in the base of the pelvis can also get injured during childbirth. On top of that, as women become menopausal and they lose estrogen, the vaginal epithelium or the vaginal skin becomes kind of thin and dry. So lots of effects on the vagina as we age, particularly, as I said, after women have vaginal deliveries. Even if women have had a C-section, maybe they pushed for a while, even if they've had a C-section, they can suffer from some of this laxity in the vagina. Often, as women age, they also develop loss of urine or incontinence for a number of reasons. One reason is putting a baby through there, and the support system of the bladder and the urethra is challenged. Another reason is just gravity and tissue disintegration and lack of estrogen. The urethra and the bladder are very dependent on estrogen for their health. As we get older, there are a number of factors that also can contribute to incontinence. And incontinence can be stress incontinence, where women lose urine when they cough or sneeze or laugh or jump or run, and they can't control it because those muscles in the base of the pelvis have a number of functions, but one of the functions is to stop the urine from coming out when there's downward pressure on that bladder. Some women have what we call overflow incontinence or urge incontinence. So when their bladder gets full, they can't control the urine coming out. Some women will walk by a toilet or put the key in the front door, and somehow their brain sends a signal to the bladder to urinate, and they don't have control over it. So incontinence is a huge problem among older women. Huge. I hear it all the time. So we have a number of brand new treatments to treat both vaginal laxity, the muscles in the base of the pelvis, and also incontinence. I'll discuss the first one. It's called Morpheus V, and this is radiofrequency microneedling of the vagina. It actually is a very comfortable procedure. The little tiny needles penetrate the tissue, and if you've ever had microneedling of the face, you know that those little tiny needles tip off a reparative process, and the body comes in with collagen and elastin and hyaluronic acid and all these good ground substances, and your skin looks better after you have microneedling. What the Morpheus V does is add radiofrequency energy to the microneedling, or heating to the microneedling. So not only do you have the reparative process from microneedling, but you also have a little heat in there that instantly shortens some of the collagen fibers and also induces collagen growth. So you get thickening of the vaginal epithelium, new elements like elastin and hyaluronic acid and as I said, collagen. So in women who feel the vaginal laxity and aren't very satisfied with intercourse, or they feel kind of open, this Morpheus V will tighten. It tightens the tissue. We can also tighten the vulva, the outside tissue, so things are a little more inside instead of a woman feeling open. Also, the Morpheus V tightens the tissue up around the urethra and the bladder. So when you tighten the tissue around the urethra and the bladder, they're raised up into more of an anatomic position. And when they're raised up into that anatomic position, it decreases the incontinence. It's like a non-surgical sling in a way. Not that it replaces a sling. You know, for women who have serious prolapse, obviously a sling is the way to go. But many women these days don't want surgery and they don't want mesh in their body. So this is a good alternative for women with relatively mild incontinence or even moderate incontinence. And when it's paired with V-tone, which is electromagnetic energy. It's a tiny device that goes in the vagina and supermaximally contracts those muscles in the base of the pelvis. So you know when you contract muscles, they get stronger and they get bigger, they get bulkier. When these muscles are stronger and a woman coughs or laughs or jumps or runs or sneezes and she has downward pressure on the bladder, these muscles oppose that pressure. So oftentimes what we'll do for patients who are experiencing incontinence is we'll team the V-tone and the Morpheus V together. And we have been getting fabulous results. I have one patient who used to wear diapers. She doesn't have to wear diapers anymore. Maybe she has to wear a little pad, but just because she's worried about it. One of my patients said, yeah, I walked all around New York City and I never lost urine. Another patient actually told me today that intercourse is much more pleasurable. She feels tighter. She feels more, protected, not so loose and not so open. I'm getting story after story about how great this combination is. And for a woman who's not losing urine, we can just do the Morpheus V and make the vagina feel just, a little more tight and up. So we're having great results. I encourage you to come in and talk to one of our physicians about Morpheus V, or if you're incontinent, Morpheus V and V-tone. Well, I hope you learned a lot from this little talk I gave, and if you're interested in Morpheus V or Morpheus V and V-tone, feel free to make an appointment with one of our physicians. We can tell you all about it. And I think for patients who are experiencing vaginal laxity and difficulty with intercourse, for patients who are experiencing incontinence, these are really great treatments. We're very proud of these treatments and the results that we're getting.